The Campaign on Accelerated Reduction of Maternal Mortality in Namibia, in short CARMMA, was introduced by the African Union Commission and its partners, the United Nations Population Fund, UNFPA, the United Nations Children Fund, UNICEF, and the World Health Organization, WHO, during the first half of 2009, during the fourth session of the AU Conference of Ministers of Health in Addis Ababa, Ethiopia. Most cultural and traditional practices on the continent put less value on women and their lives, directly deprive them from their rights. On top of that, women are also less educated than that of their African male counterparts. Arranged marriages are not uncommon in Africa, and in most cases, brides are married off against their will at a very young age. The high mortality rate is clearly manifesting these problems facing Africa. The mortality rates in Africa remain unacceptably high, and statistics show 1 in 16 women faces the lifetime risk of dying from pregnancy and delivery complications. The scenario in Namibia is not much better. Despite efforts by the Ministry of Health and Social Services to build clinics and upgrading hospitals across the country to bring health closer to the people. According to the Namibia Demographic and Health Survey, NDHS, maternal mortality ratio in Namibia has increased over the past 2 decades from 225 per 100,000 live births in 1992 to 271 during 2000. The picture looked even bleaker during 2006-2007 with 449 deaths. 32% of all child deaths occur in the first 4 weeks after birth, which can be attributed to 3 clearly identified problems: delay in recognizing the need for medical care and deciding when to seek for health care, delay in reaching health facilities on time, delay in receiving adequate and appropriate health care. With this grave scenario on the continent in mind, the AU Commission decided to act, and CARMMA was born to help those women who still must give birth to ensure a healthy delivery and a good health to mother and baby alike. The theme Africa Care, No Women Should Die While Giving Life was decided upon, and to localize CARMMA Namibia, the theme of Namibia Care, No Women Should Die While Giving Life was adopted during the CARMMA Namibia launch in Gobabis in the WHK region by the First Lady of the Republic of Namibia, Madam Penehupifo Pohamba.
Good morning.
Morning.
As fresh as the early morning air and the sun still low on the eastern horizon on December 16, 2009, a festive mood was created with a march from the Epako residential area by members of the police, the defense force, a stately parade of horsemen joined in by hundreds of residents, young and old, to the Legare Sports Stadium where CARMMA Namibia saw its own birth, making Namibia one of the first countries in the Southern African Development Community (SADC) to adopt CARMMA. Africa Care, No Women Should Die While Giving Life, now has a local face. Government and diplomatic dignitaries, high-ranking officials of the African Union, members of the United Nations and their agencies like UNFPA, WHO, UNICEF, the American President's Emergency Plan for AIDS Relief PEPFAR, traditional leaders and members of the public all took part in this gracious occasion to accept and adopt CARMMA Namibia for the reduction of maternal and child mortality by at least 3/4 and 2/3 respectively by 2015.
I am standing before you not only as a patron of maternal and child health agenda, but also as a mother. I also speak on behalf of the 500,000 mothers who die every year on our continent from avoidable and preventable deaths. This state of affairs invariably contributes to the unacceptable existence of an estimated over 12 million orphans on our continent. I equally speak today for the young girls aged 15 to 19 who are at risk of teenage pregnancy, which has the potential of resulting in maternal injury or death. I can therefore say that I speak for mothers, young and old, who are injured and die needlessly in pregnancy and childbirth from one of the preventable causes.
As proof of the government's role to be more proactive to support safe motherhood, the Tuyakula Maternal Shelter in Engela in the Ohangwena region in northern Namibia was inaugurated to serve as the shelter for 50 pregnant women. This is only one of the many projects by the Health Ministry to ensure safe motherhood.
It is now our responsibility as the Namibian nation to water the seed planted by AU and nurture this seed so that all mothers and babies can have what they deserve, which is life. Although we are in your WHK region, I would like to urge the governors of all 13 regions to take up the CARMMA initiative. They must provide sustained political leadership to guarantee quality health care for the poorest and the most vulnerable members of our societies. Protecting women also means protecting children.
But this is very serious. There is a girl who is in labor there at the house. She needs some help.
This could be just a performance by a group of local artists on a scenario whereby an expectant mother died before getting to a health clinic to give birth to a healthy baby. But the fact remains, one death is one too many. As the Minister of Health, whose mandate that is to ensure the nation's health is not compromised, Minister Kamwi elaborated on maternal death that often results from complex and multiple factors.
Maternal death often results from complex and multiple factors. There is a strong correlation between safe deliveries, a woman's educational level, and contraceptive usage. The underlying causes, though, of maternal death stem from risk factors related to anemia, malaria, tuberculosis, hepatitis, and HIV/AIDS. However, the major medical causes of maternal death are hemorrhage, which we saw here demonstrated, eclampsia or convulsions resulting from hypertensive disorders during pregnancy, abortion complications, obstructed labor, and other infections.
But it is not only doom and gloom, and the Health Ministry's proactiveness shows some moves into the right direction.
Today, we are seeing more women delivering in health facilities than before. More than 80% of pregnant women have access to maternal health services through clinics. The ministry will continue to work in partnership with all stakeholders in order to improve the environment for women and children.
CARMMA Namibia would not be possible if it was not for the initiative of the Ministry of Health and Social Services to approach the African Union's assistance, a clear proof of the Health Ministry's commitment in the nation's health. Is a clear manifestation of the urgency to implement CARMMA and thus reduce maternal mortality and achieving the goals to accelerate the reduction of maternal and child morbidity and mortality in Namibia through the provision of quality maternal and newborn healthcare services at all levels of healthcare delivery system and attain Millennium Development Goals related to maternal and child health services.